Professor Ekström, Sweden has followed an unusual strategy against COVID-19. How is it going at the moment?
Well, it's going very well at the moment, actually. The curves in terms of critically ill and also deaths in Sweden related to COVID-19 have declined since mid-April, and the numbers are now very, very low. So, and the number of new cases is also quite low in comparison to most other countries in Europe. And those who are infected seem to be mainly young people who are not at risk of becoming seriously ill. And we think it's mainly related to a very rapid increase in testing.
Sweden's new infections statistics look now much better than much of the EU. With fall approaching, do you think this trend is going to be sustainable?
Well, I think so. And I think that is actually the reason why we have such good numbers right now, because the strategy has always been more sort of sustainable in its approach, suggesting measures that are long-term acceptable to the population. We never had a total lockdown, but we've had some strict recommendations in terms of working from home. Higher education was also done at a distance, and social distance in terms of avoiding unnecessary visits to elderly, hand hygiene, those sort of measures that people, I think, have accepted to a very large extent. But it's possible to live with these measures. They don't infringe on your life and normal lifestyle too much. So that's why I think the support for these recommendations and the sustainability is so high in Sweden.
But your country's strategy had also a cost on people's lives. Authorities admitted that too many have died. Do you think that a total lockdown would have made a difference?
I don't think so, because the deaths we saw were very early in March and April, when the spread was probably already there. And it was mainly in special elderly care homes due to suboptimal working conditions, a lack of protective equipment, and also when we knew much less how to protect the elderly properly. But once health institutions and also sort of policymakers got a grip on this and sort of learned that this was really not a good thing, that we had so many, that infections came into these elderly homes and that so many people died in the first few weeks. And then things improved dramatically. So I don't think I don't think a lockdown after that would have had any impact, actually. It was mainly the routines in healthcare institutions. Our public health authorities are making regular polls to understand how acceptable the Swedish strategy is in the Swedish population, and they receive very, very good results, actually, that 9 out of 10 Swedes agree with the Swedish strategy and have also changed their habits and sort of behaviors to adjust to the recommendations of social distancing, working from home, etc., to a very, very high, to a very large extent. Some people wear masks, but very few. The large majority don't, except for, of course, in healthcare institutions, as everywhere else. But social distance is kept. I think people do try to respect this, and I think that is the key to why we still have a good, a low transmission rate in Sweden.
Professor Ekström, is it safe to say that Sweden's strategy has succeeded?
I think it's too early to evaluate any strategy at this point. I think we might be able to do that next year. But I think we need to accept that we have to live with this virus for a very long time. And to me, at least, the focus should be to reduce the number of preventable deaths as far as possible and the number of serious illness among those most vulnerable, while completely stopping this virus from spreading around the world will be very, very difficult. And we need to balance the interventions we take against COVID-19 and this virus against all the other illnesses and health problems and social problems that we have to deal with in society, and make sure we strike a reasonable balance so that we don't put all of our focus on one disease and see a lot of negative consequences on everything else that we also have to deal with and make sure works in our societies.